Hello and welcome to Awaz the Voice Interviews. I'm Nazir Ganai. India is emerging in health sector and with new technologies, new interventions, many groundbreaking surgeries are conducted every day in various hospitals across India. According to recent study, India is doing and conducting 10 lakh plastic and cosmetic surgeries per year. What is cosmetic surgery? What is plastic surgery? How new interventions are taken to upscale this field in the medicine? To talk more on this, we have with us Dr. Shahin Nooreyezdan. He's a senior consultant, plastic, cosmetic, and reconstructive surgery in Apollo Hospital in Delhi. Very welcome on the show,
Thanks,
Doctor. To begin with, I would like to, ask you, Nooreyezdan. It sounds quite Persian. It sounds quite Iranian.
Yes.
What is the origin of this?
Yeah, our family originally comes from Iran. My grandfather moved to India in the late 30s to Bombay, and we settled there as a family. And I was born in Bombay. I've grown up in Bombay, and I am very much Indian. But my name, yes, it is an Iranian name. Yeah.
And you have been in Bombay for some time, or?
Yeah, I grew up in Bombay, did my schooling in Bombay. And then I left home, of course, at the age of 18 to pursue my medical studies. And I trained in Gwalior and then in PGI Chandigarh. And then went off to England, spent a few years there, and then came back to India.
There are many interventions now, in plastic and cosmetic surgery.
Yes.
And yours is one of the few names that comes into this field. What are the challenges that you face on every day, in this sector?
You see, there's no real challenges. We're in the see, plastic surgery is a very broad specialty. We train as plastic surgeons, but nowadays plastic surgery is now been divided into, cosmetic surgery and reconstructive surgery. These are the two subspecialties.
Okay.
In the field of reconstructive surgery, it's further than there is a subspecialty of microsurgery. But there are dedicated chaps who do these procedures day and night. That's all they do. In the broader scheme of things, in a large hospital setting where I work, so we have two distinct parts of our practice.
Okay.
One is the reconstructive work, where we deal with cancer reconstructions, we deal with jaw reconstructions following jaw tumor resections by the oncologist, breast reconstructions. We deal with burn patients, road accidents, chopped off hands and fingers, we reattach them. So that's all part of the reconstructive surgery spectrum. And then we have the other half of our practice, which is cosmetic, where we make essentially pretty women prettier. There's a lot of emphasis on looking good these days. It's all about packaging, from cell phones to packets of chips. So everyone wants to look good. Men want to look slim. So we have newfangled, high definition liposuction devices where we can actually chisel six packs, on a man. The microsurgical work we do is part of the reconstructive work, where we reconstruct jaws with bones from the leg and stuff like that.
So does it come with the hazards also?
Well, there's no real hazard. Medicine is not an exact science. I say to all my patients, 1 + 1 never adds up to 2. And we're not God. There are times when we fail, but we have given it our best shot. And there's always a plan B, So yes.
So how prevalent is now, how educated and aware are patients now to go for plastic surgery or reconstructive surgeries?
You see,
earlier we used to just see this in films,
Yes.
Patients going on plastic surgery and then
and
appearance change.
That's all in the movies.
It
It doesn't happen like that in real life.
Okay.
No, that's not the case. I can't change the way you look. I mean,
Yeah.
I can change the shape of your nose, but the inherent nature of who you are will always remain the same.
Absolutely.
There is still a lot of, you know, misconceptions. Patients come to us with their daughters who've had some scars during, you know, just when they're marriageable age, and they say, "Doctor, we want you to make the scar disappear," you know, and they get very disappointed when we say, "Look, we can't make scars disappear. We can make them better, but we can't make them disappear. We have methods by which we hide scars. We have now a lot of technology like lasers. We have carbon dioxide lasers which improve scars significantly. But to make a scar disappear, you know, that's just not, even God can't do it, you know, and that's not happening."
See, you have been coming to Kashmir for a while now, and you earlier used to hold a lot of OPDs also. Kashmir went through a difficult, phase of conflict, and we saw a lot of patients, a lot of youngsters getting pellets, and
Yes.
then acid attacks also. Do you really get these kind of patients in Kashmir?
Well, I did receive a few acid attack victims, but that was not linked to the disturbances here. You know, usually it's always the, it's not usual, it's always the woman who's the victim. And it's always a case of, you know, a spurned boyfriend, or, you know, some guy who she refuses his advances, you know. We have received a few young women from Kashmir who have come to Delhi for treatment. But we have a lot more in Delhi of patients from UP and from Haryana and these states.
This is prevalent everywhere.
Oh, it's prevalent. It's all about, you know, unfortunately, the country we live in and the kind of society we are, it's all about abusing the woman. You know, people often say, "Oh, we should ban acid and sale of..." You ban the sale of acid, they'll find another way to abuse the woman. It's I don't know, it's very difficult for us. But we do get very invested in our acid attack patients, you know, emotionally. And because the operations are, you know, multiple. Some of them get 35, 40 operations, laser procedures over 8 years, 9 years, 10 years. So they become like family to us. You know?
Family.
Yeah.
So you develop that relationship.
Oh, yes, absolutely.
You know, a doctor, a surgeon like you has to be an artistic person, you know, because you chisel that the patient, you deal with that, certain kind of artistic nature. So, what is important for a patient, you know, for a person who wants to get into plastic surgery or cosmetic surgery?
Well, artistic nature, the only time I can think of where really artistic skills come into play is when we make ears. You know, there are children born without ears, and we take the cartilage from the chest,
Okay.
and then we have to carve out the cartilage with chisels, and that's probably the only operation I can think of where really we're talking about artistry. Otherwise, our operations are very standard, very geometric. There is a method for everything, and we just get on with it.
So there's a study which I really mentioned that India is conducting 10 lakh surgeries per year in cosmetics and plastics. So do you think this has evolved over the years?
That number of 10 lakhs would include, you know, burn
Rhinoplasty,
patients. It would include burn patients. It would include these road accidents. You know, people who have been run over by buses and trucks and broken jaws and, you know, stuff like that. But the cosmetic surgical operations, I don't think is in the range of 10 lakh a year. No. No. It would be essentially reconstructive work. Because if you look at it, you know, in government hospitals, which is where we all train, there is hardly any cosmetic surgery work going on. And frankly, in government hospitals, I mean, I trained at the PGI Chandigarh. We were so busy with, you know, the regular reconstructive work, the road accidents, the burns, the hand injuries, the thresher injuries. Well, there is no time for any cosmetic work at all, really. Which is why I went to England to train and
Actually, go further.
Yes, that's right.
So, doctor, how was this COVID as a challenge for you? Like, you know, many doctors, you know, tell you a different story. Some have some ordeals also, but some have some interesting stories also.
So, COVID for us was, like all doctors, it was very traumatic. I was not involved in treating COVID patients, but it was very traumatic for us because a lots of our friends, our junior doctors, our neighbors, our patients, they died. And the phone wouldn't stop ringing. You know, doctor, we need a cylinder, we need a bed. And we were really very, very helpless.
तो आपका जो origin है, चूंकि आपने कहा ये, so do you get patients from Iran also?
No. Iran has a pretty robust healthcare system.
Yeah.
And there's a lot of cosmetic work going on in Iran.
Absolutely.
Everyone has noses like mine, and everyone wants this thing, you know, straightened out. This typical, you know, Kashmiri Iranian.
Kashmiri Iranian.
Yes. So there's a lot of cosmetic work going on in Iran, despite what people may say. I know that for a fact because I have friends who are.
So do you really recall any peculiar surgery that you have conducted and you really actually, you know, you learned from it?
There's, you know, there's one story. I mean, you will see a very interesting patient this evening when I give a talk. I can show you those. I will be showing those pages. But it's in my lifetime, I've done lots of interesting operations. But one day, many years ago, I reattached a fingertip of this child. This child had come, a very small child. His father had brought him, and the father was a bearded guy like me. Talk sahab isko jod dena. And I reattached this fingertip, and the child went home fine after about 8 days. And I forgot all about it. They came post-op, you know, saw them and then disappeared, you know. Once you're fine, you're fine. Like any other, you're fine. Come from out of town. Many years later, I walked into the operation theater pre-op area and I saw this bearded guy, now with a slightly, and he was there was this boy lying on the bed, obviously waiting for an operation. And he looked at me and smiled, and I looked at him and I said, "You look familiar, man." I didn't say anything to him. I just quietly went and picked up the patient's file to see who this patient was, and the patient's name was Shahin Sharma. And I found that very strange. I said, so I went. He said, "Doctor Sahab, aapne pehchana nahi hai." I said, "Oh, main nahi pehchana." He said, this is your patient, Golu, the one whose finger you reattached." And I said, "So what did you do?" He said, "Doctor Sahab, we were so grateful and so thankful for what you did for us that I changed his name to yours." So for me, that was, I cannot describe that feeling. It's indescribable, really. It's been something that will stay with me forever, you know.
Very interesting.
Yes.
And this can happen in this part of the world.
Yes, in this part of the world. Yes. Oh, wow. Yeah.
Very, very interesting.
Yeah, that's right.
So on that note, I think there are many things to be discussed.
Yes.
And many interesting stories to be taken ahead.
That's right.
Thank you so much for giving us your time.
Thank you so much.
We wish you all the best for your program in Kashmir.
Yeah, and I shall see you this evening.
Keep coming.
I'll see you this evening. Yeah. Take care. Thank you.